Hello everyone, my name is Rolando, and today I'll be going over ACSM's pre-participation screening algorithm. So, what is the purpose of screening? It provides a way for exercise professionals to identify individuals at risk of cardiovascular complications during or immediately after exercise. This new algorithm that was made by ACSM is meant to replace the old risk stratification that they used to use for screening. The old screening method would kind of pull people in that didn't absolutely need medical clearance, and it would create a hassle for those clients. And, going that extra step to actually start an exercise program might turn some people away from exercising in the first place. Moving on to algorithm components. There are three main components. The first one being identifying individuals that do or do not participate in regular exercise. Regular exercise is identified as moderate intensity for at least 30 minutes on 3 or more days during the past 3 months. This is an important component because identifying those individuals who are not acclimated or used to working out is good because their body's undergoing new stresses, especially if they live a sedentary life. The next component is identifying individuals with known cardiovascular, metabolic, and renal disease, or those with symptoms suggestive of these diseases. Another important component because these diseases could lead to some kind of cardiac event occurring during or after exercise. And even identifying those who even have symptoms suggestive of these diseases, even if they are undiagnosed, is good because they might have an underlying disease that they don't know about. Lastly, we have identifying the desired exercise intensity that the client wants. This is very important because we want to make sure that this desired intensity that they want or that we want for them is appropriate. We don't want someone who is sedentary and has a cardiovascular disease to immediately go into vigorous intensity because if you go from low to moderate to vigorous, you increase that risk of a cardiac event happening, even in healthy individuals. On this slide, we are going to be going over the signs and symptoms suggestive of cardiovascular, metabolic, and renal disease. So first up, we have pain or discomfort in the chest, neck, jaw, arms, or other areas that may result from ischemia. Dizziness or syncope, which is just loss of consciousness. Ankle edema, which is swelling around the ankle. Intermittent claudication, which is pain in the lower extremities. Unusual fatigue or shortness of breath with usual activities. Shortness of breath at rest or with exertion. Palpitations or tachycardia, defined as an unpleasant awareness of the forceful or rapid beating of the heart. A known heart murmur, and orthopnea, which is shortness of breath, kind of when you're in a recumbent or laying down position. On this slide, we'll be going over aerobic intensities. The level of intensity, which ranges from very light to vigorous, is important in the sense of being able to identify whether or not your client was participating in regular exercise prior to starting a new exercise program. And again, in order to be considered participating in regular exercise, you need to be working out at a moderate intensity, which we can see is around 64 to 76% of your heart rate max and 40 to 59% of your heart rate reserve. Some other intensities that you might see being used by some exercise professionals are METs and rate of perceived exertion. Moving on to actually using the ACSM's algorithm. The guidelines for exercise testing and prescription has provided us with a little figure that's nice to use and kind of show how you progress in identifying whether or not someone needs a medical clearance. So I'm going to be using my mouse kind of to track where we're at on the chart. So first, we're going to start with asking them if they participate in regular physical activity. So let's say they say no. The next thing we would do is kind of identify if they have any known cardiovascular, metabolic, or renal disease, and whether or not they have signs or symptoms of these diseases. If they don't have any diagnosed diseases or any signs or symptoms, medical clearance is not necessary for this individual, and they can move on to light to moderate intensity and then gradually progress to that vigorous intensity. So, what if they don't participate in regular physical activity, but they have a known disease and are asymptomatic, which means they have a disease and they don't have any signs or symptoms? They still need medical clearance, and this medical clearance is needed to participate to light to moderate intensity exercise. Moving on to the next section of the chart. What if they have any signs or symptoms, regardless of disease status? Medical clearance is still needed. And we'll be going over kind of the main differences at the end of this slide between the participants who do participate in regular physical activity and those who don't. So moving on to those who do participate in regular physical activity. So again, if they don't have any diagnosed diseases or any signs or symptoms, medical clearance is not necessary. And the intensity that they can continue with is a little different because again, these individuals have already been participating in moderate intensity for over 3 months. So they can continue to moderate or vigorous intensity. So what if they have a known disease and are asymptomatic? They don't need a medical clearance, at least not for moderate intensity. If they do have a disease and are asymptomatic, to move on to vigorous, they would need medical clearance if within the last 12 months there has been no change in signs or symptoms. So, what if they have any signs or symptoms regardless of their disease status? They need to discontinue their exercise and seek medical clearance. So, as you can see, the main difference between these are kind of whether or not these individuals are conditioned. So, a way that I kind of like to think about it is if they don't participate in regular physical activity, the only way for them to not need a medical clearance is if they don't have any diseases or any signs or symptoms. Besides having both these conditions met, you're going to need some kind of medical clearance. Moving on to those that do participate in regular physical activity. The only time they would need medical clearance is if they, again, show any signs or symptoms, and if they have a known disease, are asymptomatic, but want to participate in vigorous intensity exercise. Thank you all for listening today. That's everything that I have. Make sure to check out acsm.org's website just in case I missed anything or you have any further questions. They're a great resource for anything regarding exercise prescriptions and pre participation screenings.